used to seeing paramedics in action, rushing from one emergency to another.
So we're just going to check your blood pressure, make sure everything looks okay.
But here in Hamilton, Ontario, they're also doing something different that doesn't require an ambulance.
Morning, Muriel.
Good morning.
How are you, darling?
Joe Cox is a community paramedic. He and others go into buildings for low-income seniors, invite residents to come in for a weekly visit, have their risk of falling assessed, check their blood sugar and blood pressure.
You're a little bit high. It's like a lie detector. This guy's making you nervous.
A study published this week in the Canadian Medical Association Journal found those community paramedics have reduced the number of 911 calls from 4 calls per 100 apartments a month to just over 3.
And we think that why that's happened is because we're actually targeting the population before they get to make the 911 call.
The study's author says while the health information can be passed along to family doctors, not everyone was on board with the program.
I think at first doctors weren't sure about this.
Not sure because it's expanding the traditional role of a paramedic. But others say the system needs innovative approaches to cope with an aging population and overcrowded emergency rooms.
I think we should worry less about creating turf and silos, saying only this type of provider can do this, only physicians can do this, only nurses can do this, as saying what are the skills and knowledge we have that can safely deliver care, and how do we work as a team.
These would be the same as in the ambulance, just laid out differently.
Nova Scotia is also innovating senior care with specialized paramedics. They're responding to 911 calls and navigating each health crisis with backup from nurses and doctors if needed.
As it turns out, about 70% of the time that extended care paramedic actually treats the patient on scene, doesn't transport them to the emergency department, and actually keeps the senior comfortable and safe at home.
The fear is always something may be missed if a patient doesn't go to the hospital. But this ER doctor insists prioritizing patients is key to the entire system.
There's a lot of demand on our emergency room. Our frontline teams work very hard in the emergency room, and to be able to triage what comes in more effectively is a benefit to everybody.
Yeah.
Researchers also found community paramedics provided another benefit. Seniors said this chat improved their quality of life because it made them feel less lonely.
All right, young lady.
Okay, so I'll see you.
Thank you for participating.
So I'll see you in 2 weeks.
Christine Birak, CBC News, Hamilton, Ontario.
Oh, yes.
There is another potential benefit to all this. Consider that when a patient calls 911, an operator may have to dispatch a paramedic who then travels to the patient to do an assessment. That patient may be taken to hospital in an ambulance to get assessed again by a doctor or a nurse, and all that costs the healthcare system. In fact, the study's author says the average Ontario 911 call costs about $1,600.